Adaptive is a global leader in the technology to assess immune responses using next-generation sequencing of immune cell receptor sequences, so-called repertoire sequencing. And repertoire sequencing is now being recognized as a critical factor in understanding immune biology, but also increasingly cancer biology, both in terms of immune responses to cancer and also cancers of the immune system. Most relevant to ASH this year is the new data we are publishing using our product called clonoSEQ. So clonoSEQ is a method of assessing minimal residual disease using next-generation sequencing of the immunoglobulin rearrangement that's present in the malignant B cells. Specifically, what clonoSEQ allows you to do is assess very, very tiny amounts of cancer present in various tissues, including bone marrow and blood, to establish after treatment for patients that are otherwise appear to be in complete remission, whether there is any residual disease which could result in a fatal relapse for these patients. And the reason MRD assessment is so critical to modern lymphoid cancer care is that with the advent of so many new therapies, in multiple myeloma there are 3 new therapies approved in the past month, and these therapies are increasingly getting patients into deeper and more sustained remissions, but not curing everybody. The assessment of which patients are achieving good deep remissions that result in long sustained remissions versus patients that need additional therapy is becoming a critical factor in understanding how to apply these new techniques. And so our clonoSEQ assay for measuring MRD has been established, including at presentations at this conference, as the most predictive factor in the assessment of which patients are likely to have a good outcome to these therapies. And so that's useful both in the methodologies in which doctors are using MRD to intensify therapy, and we had some presentations here in which intensification of therapy in MRD positive groups resulted in improved outcomes in multiple myeloma after an auto transplant. We also had presentations about how one might in the future use this technology to reduce the intensity of therapy. A presentation today by a group from Toulouse and a large prospectively treated cohort showed that achievement of MRD negativity with or without a transplant was associated with equivalently good response, which opens the possibility for reducing transplants in MRD negative patients. So the use of this very predictive biomarker will be increasingly used to guide these new therapies in myeloma and in other lymphoid cancers.